Welcome to Dr Sudha S Murthy's Precision Cancer Question, where we challenge the status quo in cancer care, one question at a time. Today's precision cancer question is, if I suspect a therapy relevant mutation, how do I communicate it meaningfully to the treating oncologist? In many labs, the NGS workflow ends with the report generation. A variant is listed, maybe annotated, sometimes buried. But clinical action? That's someone else's job. The real danger, there may be missed moments of intervention, especially when the mutation might open a door to a targeted drug, a trial, or even just a prognosis altering conversation. Remember, we all need to be patient centric, and we as pathologists need to work with oncologists to ensure that the patient gets the right treatment. Let's take a real example, a triple negative breast cancer patient, and the NGS report shows a PIK3CA mutation. That's a tier 1 actionable finding in some contexts. But if you just list it under mutations detected with no clinical flag, what happens? It may sit unnoticed, especially in an exhaustive report. Now imagine if you wrote presence of PIK3CA mutation may indicate eligibility for alpelism in hormone receptor positive disease and warrants MTB discussion in select triple negative breast cancer cases with progression. Or you could simply email the oncologist. Precision oncology doesn't start with the drug, it starts with the right flag at the right time, often from the pathologist. Our role is no longer confined to HND and IHC. We are the first line of detection for what may become the last line of therapy. Communication isn't a luxury, it's a responsibility, especially when variant interpretation leads directly to treatment implications. So, therefore, a few tips for pathologists, especially oncopathologists. Use structured commentaries. Therapy relevant mutation detected. Suggest clinical correlation. Might help. Flag cases for weekly molecular tumor boards proactively. Be curious enough to follow the case beyond the report. So, next time you sign out a case with a clinically relevant mutation, don't just ask, have I reported this correctly? Ask, have I made it clear enough for someone to act? Because in precision oncology, the conversation is just as important as the code. Till the next time, reflect, innovate, and react. Bye bye, and thank you.